Dr. Tanya Swam.
Madam Deputy Speaker, as President of the SMA, I have been involved in some prior discussions on Healthier SG. The Ministry of Health has been actively engaging the College of Family Physicians and the Singapore Medical Association and is aware that doctors broadly support this move. We support the shift in emphasis on treating disease to prevention and to strongly support the individual's health in primary care via the family doctor and community support. I speak now to raise specific concerns and hope that these will be considered as we embark together on Healthier SG. I would like to remind everyone here that we must consider the whole healthcare ecosystem and not strictly segregate primary versus specialist care or restructured versus private sectors when problem solving. First, some context and background. I am a general surgeon who has worked in several restructured hospitals before stepping out to private practice as a breast surgeon 3 years ago. And as Dr. Lim pointed out about wellness, I am registered as breast friend surgery and wellness because I advocate strongly for prevention of breast cancer. During an administrative briefing many years ago, I once saw patients described as clients and doctors are called service providers. I was saddened and devastated. That's when I decided I will do what I can to reclaim back the doctor-patient relationship for all of us. It is demeaning to think of healthcare purely as a business or a transaction of payment for services rendered. Those of us who have enjoyed good doctor-patient relationships, and I have been on both sides, understand the world of difference it makes. Having a good family doctor provides that strong anchor to look after you and your family, and in turn refer you to the necessary and relevant specialists for additional care. In real life, the difficulties and limitations of logistics, insurance panel restrictions, and personal preferences will affect the flow of care. I have spoken on the problems with the integrated shield plans previously, and I'm glad to report that there have been some progress made. What other broad challenges exist now for healthcare workers? 3 things. 1, IT support. 2, manpower. And 3, the elephant in the room, respect for healthcare workers. Let me elaborate. The newspapers have reported on the national downtime affecting electronic healthcare systems in restructured clusters, and this House has had updates from MOH on investigations. As SMA President, I received lots of feedback on the struggles that healthcare workers face on the ground. Complaints and angry patients aside, what we are more worried about is the potential lapses of care, as backup manual paperwork is done during downtime, and then healthcare workers have to stay back to load the relevant information back into the electronic system. Duplicate documentation. Can you imagine how many man-hours are wasted rather than focusing on actual patient care? As much as we understand the need to make things electronic, most healthcare workers are wary and cautious of the rollout of the NEHR. I thank Ming Ong for acknowledging our concerns and recognizing the need for good IT support and adequate monetary reimbursements. May I also suggest we need legislative support in the event of unexpected complications in trying to implement the changes. For example, in the cybersecurity of electronic health systems, be it the clinic's own records or the national system. I also propose that there should be education and encouragement for patients to take ownership of their own health records in the Health Hub and to actively share relevant information with their attending doctor. Why is this mindset important? I personally would like some of my medical information private. Just as an example, if I had a previous miscarriage, an abortion, mental health issues, I would not like every healthcare worker to know about them. I would choose to inform my attending doctor what I feel is relevant, or if they ask, I will question, is this information going to make a difference to my current condition? I value confidentiality and privacy. In conjunction with Healthier SG, let's remember to educate individuals on the importance of personal care and responsibility. Next, manpower issues may not be solved just by hiring more healthcare workers. It is not just the number of staff, but the experience of each staff. Losing one nurse with 10 years of experience and intensive care unit training, can she be replaced by 5 new nurses? Look to retention of staff for senior trained doctors to stay in public sectors, for experienced nurses and allied health to want to stay in Singapore. It is good that there's more training and new hires for Singaporeans and for foreigners, but how do we actually retain them? Exit interviews should be taken seriously to evaluate systemic problems or work culture differences. My own exit interview some years back, the schedule was changed a few times, and eventually it was a new HR staff who met me to take back the staff pass and sign some papers as a formality. I hope MOH continues to engage all stakeholders on a regular basis and to take our considered feedback. The tripartite committee looking into the welfare of our junior doctors is a positive step. How about other groups? Why are the foreign nurses who have worked and trained here for years moving on to work in other countries? Is it purely about matching the salary or struggles with setting up a family and their childcare needs? What are the subsidies available for foreign staff in childcare centres? I take note that certain kinds of leave are eligible only if the child is a Singaporean citizen. How may we help them to find a home and be willing to be here long term? Would it be possible to consider offering PR status for the healthcare worker after 1 to 2 years of working here, and maybe even extending PR status to the immediate family after a longer period of work, let's say 5 years? I do not know. Specialists have also raised concerns about the capitation model. In particular, will there be funding for complex cases such as transplants, or if a routine case runs into complications? The feedback from senior specialists in restructured hospitals is that should there be a decrease in the number of complex cases, it will affect the training of our younger specialists. In the long run, we worry that the quality of care will be affected adversely, as well as our standing as a leading medical health hub. Finally, I address the elephant in the room: respect for healthcare workers. After the hurrah of healthcare heroes during COVID, now we struggle with a backload of business-as-usual cases, long waiting times, general unhappiness. Perhaps the average layperson doesn't quite understand how complex the healthcare system is. In having team-based care, with nurses and allied health taking on so much of the healthcare needs, this should be recognized by having the patients know that these are all professionals who are trained to deliver specific interventions and health outcomes. As an example, I perceive that sometimes patients don't understand the importance of, physiotherapy after surgery and neglect to keep the range of movements, resulting in a frozen limb, and then wrongly blaming the doctor for bad surgery. For patients who come to the hospital for the first time ever with end-stage organ failure, I am deeply saddened. Why the years of neglect? Was it a lack of awareness or lack of resources? How about the role and responsibility of the immediate family in reminding the elderly loved one to go for regular checkups, advise compliance with medications, and to take active steps to modify this? On the one hand, we see some patients who have chosen not to know anything about their own bodies. On the other hand, we also see some people who Google non-stop and take bits of information with inadequate context, even to the extent of arguing with healthcare professionals about what is correct medical care. I wonder, do people argue with lawyers or bankers this much in legal or financial matters? What is the right balance? I always believe that education is key. Good basic health education and understanding how our body system works, how the body gets ill, is essential to keeping oneself healthy. Establishing a good doctor-patient relationship and having mutual trust in each other gives much better patient outcomes and satisfaction. The rise of badly written search engine optimization articles is severely detrimental to the doctor-patient relationship. So many articles share half-truths and myths, even fear-mongering. As a council doctor of the Singapore Medical Association, I will continue to advocate for this: public education and allowing doctors to do our work well with adequate support. Each and every one of us here has to play our part well in taking responsibility for our own health. In the launch of Healthier SG, I look forward to the shift of care to a community-based care and truly embody prevention is better than cure. Thank you.